Good morning, everyone. We're going to call our meeting to order, June 16th, Board of County Commissioners meeting. Mike, would you lead us in the pledge, please?
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mike. Please call the roll, clerk.
Commissioner District 1, Randy Netherland.
I'm here.
Commissioner District 2, Kevin Schutte.
Here.
Commissioner District 3, Sharon Trask.
I'm here. Thank you. Do we have any correspondence to report?
Yes, Olympic Region Clean Air Agency, or ORCA, sent in a letter regarding contribution for calendar year 2021. Federal Emergency Management Agency sent in a letter of map revision. Department of Natural Resources sent information on the Kennedy Creek Natural Area Project number 20-1422. And the Washington State Liquor and Cannabis Board sent a change of location approval for Smooth Sailing Ventures.
Thank you. Moving on to item 4.2, contract award. Mike, is this for you? The Salt and Patch Storage Facility?
Yes. We're got a bid of $337,000 and we'd like to move forward with the project.
Perfect. All right, thank you. Moving on to item 4.3, news release for the Mason County Board of Equalization membership, and ask Commissioner Schutte to please read that.
Madam Chair, the Board of Mason County Commissioners is seeking applicants for 2 positions on the Mason County Board of Equalization, 1 regular member and 1 alternate member. The term of each position will end on May 31st, 2023. Applicants must reside in Mason County. The Board of Equalization is a 3-member board appointed by the Mason County Commissioners. 2 alternate members may also be selected. The board's responsibility is to ensure that all property valuations are 100% of market value, so equitable tax assessment can be established. Taxpayers may appeal their assessments, including assessments of real and personal property, forest land, timber, and open space. The board also considers denial of senior citizen property tax exemptions. Taxpayers can file a petition with the Board of Equalization, and a hearing will be scheduled to present their appeal of their assessment for timely file and completed petitions. Depending on the number of appeals heard each year, the board may meet up to 3 days a week throughout the year. 4 members are paid a per diem, currently $100 per day when in session. As required by RCW 84.48.042, the successful applicant must attend training provided by the Washington State Department of Revenue within 1 year following appointment or reappointment. Interested citizens may obtain an application at the Mason County Commissioner's Office, 411 North 5th Street, Shelton, or by calling Shelton 360-427-9670, extension 380. Belfair 360-275-4467, extension 380. Elma 360-482-5269, extension 380. Or visit the Mason County website at www.co.mason.wa.us. These positions are open until filled, with first review July 7th, 2020.
Thank you. Moving on to item 5, this is the time we've set aside for citizen input. However, in response to the COVID-19 outbreak, we're suspending citizen input at this time, although we would highly recommend and highly encourage you to send us an email at mdrury@co.mason.wa.us, or you can email the Commissioner's Office at 411 North 5th Street, Shelton, Washington 98584, or give us a call at 360-427-9670, extension 419, and all that information is also on our screen. Thank you, Deidre. Moving on to item number 6, adoption of the agenda.
Madam Chair, I move for adoption of the agenda as presented.
Second.
We have a motion and a second to adopt the agenda as written. All in favor?
Aye.
Aye. Agenda is adopted. Moving on to item number 7, approval of the minutes.
Madam Chair, I move approval of June 8th, 2020 briefing minutes and May 19th, June 2nd, and June 9th, 2020 regular meeting minutes as presented.
I'll second.
We have a motion and a second to approve the minutes. June 8th, 2020 briefing minutes, May 19th, June 2nd, and June 9th, 2020 regular meeting minutes. All in favor?
Aye.
And the minutes are approved. Moving on to item 8, approval of our action agenda. Commissioners will read through the action agenda, and then commissioners or public or anyone sitting in the room can ask for an item to be removed for separate vote and discussion. Commissioner Schutte, could you read item 8.1 through 8.5? Commissioner Netherland, read item 8.6 through 8.10, and I will read 8.11 through 8.15.
Madam Chair, item 8.1, approval of the resolution rescinding Resolution 92-86, disbanding the Emergency Medical Services Advisory Council. Item 8.2, approval of contract number CL.COVID19.sprinkler with Community Lifeline to install a fire suppression sprinkler system that will increase shelter capacity and allow year-round operations as part of the COVID-19 response. Item 8.3, approval to appoint Kevin Frankieberger, member, and Kim Wilson, alternate member to the Mason County Board of Equalization for a 3-month interim until August 31st, 2020. Item 8.4, approval of a memorandum of understanding between Mason County and Mason County Search and Rescue to transfer 2 vehicles to SAR. And item 8.5, approval of warrants and treasurer electronic remittances, claims clearing fund warrant number 8072812 through 8073005 in the amount of $495,596.41. Direct deposit fund warrant number 68772 through 69157 in the amount of $783,539.83. And salary clearing fund warrant number 7005217 through 7005251 in the amount of $1,068,418.54.
Madam Chair, item number 8.6 reads, approval of a resolution setting a hearing date with the hearings examiner for Wednesday, July 22nd, 2020 at 1 p.m. to consider public comments on the petition for vacation of a portion of an unused road in Lakewood Plat A, once named Alder Street, currently known as East Eleanor Peak Place, between Block 1, Lots 1 through 8, and Block 2, Lots 1 through 4, and 5 and 8 through 8. Item number 8.7, approval of the resolution setting a hearing date with the hearings examiner for Wednesday, July 22nd, 2020 at 1 p.m. to consider public comment on the petition for vacation of a unused portion of East Mason Lake Drive west in the plat of Maddie's Sunny Shores Addition number 3. Item number 8.8, approval to authorize Public Works to purchase 6 portable speed display signs off a state contract with the Department of Enterprise Services. Item number 8.9, approval of the following recognition updates within Public Work, or reorganization updates within Public Works. Approval to eliminate 4 positions, Engineer 3, range 33, Road Operations and ER&R Manager, range 38, Assistant Road Operations Manager, range 34, and Operations and Maintenance ER&R Administrator, range 25. Approval to create 1 new position, Engineer 1, range 26. Approval to create and post and fill 2 positions, Road Operator Manager, range 34, and Personal Risk Analysis, range 21. Item number 8.10, approval of the Mason County application to move to Safe Start Phase 3. Doesn't stay on the rubber, so.
Item 8.11, approval to expend up to $15,000 in County CARES Act funding for a scheduling queuing system with QLES for the offices of the assessor, auditor, and treasurer, and approval to have the chair sign the contract. Item 8.12, approval of a letter to Waste Connections LeMay Enterprises Incorporated regarding the solid waste flow contract. Item 8.13, approval to appoint Darren Holland to the Planning Advisory Commission for a term ending December 31st, 2022. Item 8.14, approval of the declaration in support of the Pacific Coast Shellfish Growers Association to the United States Court of Appeals for the Ninth Circuit. Item 8.15, approval of a letter to Governor Inslee regarding the initial disbursement of CARES Act funding to local governments. Having read through the action agenda, are there any items we would like to be removed for a separate vote or discussion.
Madam Chair, I'd like for item number 8.7 and 8.10 to be removed for a separate discussion, please.
8.7. Okay. Are there any others?
Commissioner, what was that second one that you asked for?
8.7 and 8.10.
Madam Chair, I'd also like to have item 8.9 removed for a
Okay.
separate discussion and vote.
All right, do I have a motion?
Madam Chair, I move for approval of the action agenda, removing 8.7, 8.9, and 8.10 for a separate vote.
Second.
Okay, we have a motion and a second to approve the agenda item, but remove items 8.7, 8.9, and 8.10 for separate discussion and vote. All in favor?
Aye.
Aye.
Aye. And the action agenda is approved. Let's move on to item 8.7. Approval of the resolution setting a hearing date for the hearing examiner for Wednesday, July 22nd, 2020 at 1 p.m. to consider public comment on the petition for vacation of a portion of an unused portion of East Mason Lake Drive West in the plat of Manning Sunny Shores Edition Number 3. And ask staff to come forward to brief.
This is a petition from Michael Williams, owner of property 4000 E on Mason Lake Drive. They requested a petition to vacate a portion of unused of East Mason Lake Drive. It's actually across the road from our existing right-of-way. Our existing right-of-way is about 60 feet wide, and so the request is to vacate the portion on the other side. We're just asking for the board to set a public hearing.
Discussion?
Yeah, I will not be speaking in favor if there's a motion. It's not that I have an issue with anything that they've done there. Historically, I just don't believe, for the most part, in supporting vacations. It's a value that the people own, and there should be some type of compensation. Well, I found out in talking to our engineer that other counties do actually have compensation for that. So I would like to eventually have that conversation. There was one right before this that I did not have an issue with, and the reason why is I believe that there was a common good that the citizens of Mason County get by getting that vacation, because there would be some water issues that would be taken care of by them putting in a road there. So there was a benefit. But because of that, I'm just never supportive historically of these with no compensation or anything for the people of the county.
Yeah, so I will, I'm gonna make a motion to move this forward, but I concur with Commissioner Netherland that I think we should have a discussion about how we handle these in the future. We've been seeing more of these coming up, and absent an actual policy on that, I think it would be difficult for me to not support moving forward with it at this point, but definitely would like to revisit that with staff and the commission going forward. I think that would be a good policy cleanup for the county. So with that, Madam Chair, I move approval of item 8.7.
Okay, I'll second. So we have a motion and a second for item 8.7. All in favor?
Aye.
Aye. All opposed?
Nay.
All right, and it'll be moved forward to the hearing examiner. Thank you. Let's move on to item 8.9, approval of the following reorg updates within Public Works, and ask staff to come forward to brief.
Morning, Commissioners.
Good morning.
Good morning.
So this morning before you, we have a proposal to make some revisions within the department. The drivers behind these revisions are several, and some of them are financial in terms of looking at revenue reductions that we're facing. We're also looking at, as you know, in our utilities, we're very pressed and tight in terms of overall budget, and we've got significant improvements that are needed within our utilities and a small rate base. So a need to absolutely make sure that we're being mindful of how best to manage those funds. We've also had revisions within ER&R that removed a portion of the work related to overall county fleet management that led to some changes and a need to evaluate how we're operating and managing and administrating that fund. And just in terms of just overall coordination, collaboration within not only the department itself and the divisions, but external, and making sure that Public Works is a great overall county team player. And as a result of many of those drivers, we've recommended the changes before you, and have had some months to go through this and look at how best to move forward. And although this is somewhat a difficult decision and recommendation, it is also, in my mind, the best recommendation for the county and being mindful stewards of the county taxpayer dollar. And with that, I'm happy to answer any questions you may have.
I appreciate you coming forward and explaining this. There's been a lot of debate.
Yes.
And a lot of, I know you and your staff have spent countless hours reviewing this, and so I appreciate that.
Thank you. And I appreciate the support from our other departments as well, because it's taken some outside view and assistance, and certainly Human Resources has been very helpful in that regard. So I appreciate that. And Commissioners, I appreciate your time as well.
Thank you.
Thank you.
Do we have a motion?
Madam Chair, I move approval of item 8.9.
I'll second. I expected it to be longer than that.
We have a motion and a second to approve item 8.9. All in favor?
Aye.
And it is approved. Thank you. Move on to item 8.10, approval of the Mason County application to move to Safe Start Phase 3. There's been a name change.
Yes, there has been. All right, Commissioners, I'll take a few moments just to go through the application packet and process. As you know, move from Phase 1 to Phase 2 was the first time we've done anything like this, and that was, of course, that was a variance. This is actually just an application, so they did change the terminology on it. Moving from Phase 2 to Phase 3, in your packet on the first page, you'll find a letter from me to John Weisman, who's the Secretary of Health, basically in a very short outline the plan for Mason County moving forward into Phase 3. The takeaways on this are our continued focus on keeping people safe while moving the economy ahead, number one focus on all things we do. Noting that there's no industry-specific guidance beyond what's already on the DOH website that we're expecting. So moving forward, we'll be using the business opening template for all businesses not specifically referred to in the industry guidance. Our timeline will be, we'll move into Phase 3 not earlier than 22 June 2020 or 48 hours after the official approval notification from DOH. That gives us the ability to move to Phase 3 next Monday and open our county-facing offices, unless DOH pauses that and doesn't get to it until the weekend. So it gives us another 48 hours after the announcement from DOH for us to make sure that all notifications go out. We're putting together a notification package this week through the Joint Information Center, which will go out through our public information channels. That will outline and make it very clear that we're applying for Phase 3. We're not in Phase 3 until we get the authorization from DOH, and then we'll, as soon as we get that authorization, then we'll publish the timeline and the date. So that's the first page. Also on the first page you have the Safe Start template, and it's available online. So again, businesses that don't fall into those industry-specific pieces can use that. And that's also for nonprofits, clubs, those sorts of organizations as well. They can do the business template. Not everything will apply to them, but they can use that to fill out to make sure they have a COVID plan in place that's acceptable should anybody, L&I or somebody inquire about it. So it keeps our local nonprofits and clubs safe. The second piece is the actual request for variance, and we're still using the same language. Statement of purpose, we talk about the Mason County population and the need to go into Phase 3. We talk about the most vulnerable populations and preserving our capacity in our healthcare system. So at the bottom of the page, you have the metrics that are posted by DOH, and we are good to go on all 5 of the major criteria that DOH is looking for. So we have yeses all across the board. Going on to the next page, you have the Mason County application for variance matrix. This is just a distilled version of the whole document onto one page that shows the targets we're trying to hit and then where Mason County stands. So for example, in COVID activity, we're looking at a target of less than 25 cases per 100,000 per 14 days. And where we're at, our crude rate is at 4.6 cases per 100,000. So we are very well underneath the threshold. Healthcare system readiness, we're at 68%. The target's 80%. We're looking for 1 positive per 50 tests. So and we're averaging about 100 tests per positive case. So we're well under that as well. We're reaching all of our goals on case contact and case investigation. And typically we have those resolved within 12 hours. The standard is 48 hours, and we typically have those done within 12. So, and then, after the 12 hours, we continue to contact those contacts daily to make sure that they have, the means to maintain quarantine or isolation. So, and we follow those throughout the course of the disease and until they're through. So, our staff is on top of that all the time. Moving on, we have the epidemiological curves, and it shows how we had our spike really back at the very end of March, first part of April, and we've been pretty flat ever since. We're averaging about 1 case per every 4 days, so we're well within our capability to react. The application narrative starts on the next page. Shut that off. So we've had no deaths since phase 2. Basically, all this data is collected around what has happened since the beginning of phase 2. I did throw some things in that went back all the way to the beginning of the COVID timeline. Just as a counterpoint. So we've had no deaths since phase 2. We've had 1 hospitalization. We've had 2 cases, 1 family, and 1 other. So since the beginning of phase 2 until the timeline when this was put out, which was the 13th, we had 3 cases. Since then, we've had another case. No ongoing outbreaks. And then we are asked to do a description of the time from onset of symptoms to getting tested, and the numbers are so low we can't calculate a median that way. So we maintain our testing capabilities. Mason County has Mason General Hospital doing the drive-through testing. They've also added BioFire to the system, so they're able to do rapid tests as well. And those are very helpful for nursing home patients who have been in the hospital for some other reason, need a clean test in order to go back to the nursing home, so they're able to use BioFire, get them a test right away, and get them discharged to the nursing home. It's been a great addition to the community. Median number of days, we've covered that. For each of the weeks, so we've had 3 weeks. We've had 1 positive test the first week, 2 the second week, 1 the third week. So it gives us, out of 680 tests, we've had 0.5% cases positive. Again, we're well underneath the thresholds. We then go on to describe in some detail our ability to react to outbreaks. So at this point, at the point I wrote this a couple days ago, we have 15.2 FTE who are trained investigators. We've since added 2 more who went online and took some more testing. So actually we've increased our capability. We also have an MOU going out to DOH at the bottom of the next page, reliance on DOH sources. We've had a number of discussions with John Wiesman about what we would do in the event of an outbreak, because we've been at this a long time now. The nurses have been working weekends, evenings, since this began. DOH had a phone call with us last week to determine what the actual numbers we would need for case contact, and should we have to stand up our alternate care facility, or if we have to stand up building 10 for quarantine and isolation, what those numbers would look like for non-medical personnel. We're getting agreements on who we would get and how soon we would get them. So DOH was very impressed with asking for an MOU that would solidify their response in a request to a Mesa County call for assistance. So that's going well. We should have that by the end of this week. Facilities used, we discussed that in some detail. We begin to talk at the end of that about the community Lifeline homeless shelter, where we added 30 beds with the addition of a sprinkler system, as you voted on earlier, we have the ability for them to meet fire code in order to move to year-round, if necessary, homeless sheltering. And we've had homeless sheltering there since COVID started. We've extended it. Normally they end the 1st of April. We extended it through April, May, into June. And we've had no outbreaks within the homeless community. So I think that has been very successful by getting people in and making sure that they had a good place to go, they had food, they had a way to separate themselves. That I think was very successful in keeping that disease out of that particular population. We do talk about in-home isolation. So if we have people who are need to isolate at home or quarantine at home, there are resources. One of the things that has leapt to the forefront is if we have people who are low income and they feel they need to go to work in order to pay the rent or to pay their food bills, there is money available for us to step in and pay the rent and pay for food so those people can stay home for their 14 days and ensure that we get through the quarantine process and people can get back out and get on with their lives. Again, we address outbreak investigation. Very important as we go into phase 3. Our planning efforts will shift from getting us into phase 3 into looking at what we'll need for the fall in case, with the possibility of schools opening, what does that look like? And then should there be a resurgence, how would we deal with that as well? So that is the planning method from here on. Again, we go to the Mason County Plan, which just reiterates the first page of the letter. We go to hospital data, which shows the hospital use of PPE and their maintenance of that. Next chart shows there's a new system now called Law Health that the hospital inputs their data into every day about how many masks they have available, gowns, all those things. And as you see, the hospital is definitely hitting the numbers on that, looking very good. The following page looks at the system at a glance. What are the percentages of beds and bed capabilities that we need, and we're meeting those. At the bottom, you see we put in a chart about our disease activity since the beginning of March. We had our peak again in early April, and now we're basically at, it shows 4.6, but right now it's dropped down to 3.2. I did not put that in there because that's not the authorized number at this point because DOH hasn't finished reviewing that. And then lastly, in the packet itself, we look at our bed availability, and we had a spike there at the hospital, a spike of 1, and now we're back down to 0 people in the hospital with COVID-like symptoms, or COVID. People can be in there with COVID-like symptoms until they're identified whether they do or do not have COVID. So we've had 1 that was positively identified in the hospital with COVID, and that person's been released. We do have the next piece, which is a letter from our health officer, which this whole thing is pinned on, is the health officer recommends for us to go forward first. We put the plan together, we've got the letter there. We have a letter from the hospital, so the 4 things that we require in addition to the plan is a letter from the health officer, a letter from the hospital, and then resolutions from both the Board of Health and the Board of County Commissioners. The Board of Health reviewed this plan this morning and voted in favor, so this is the last step in the process. If you approve this plan, we'll remove the draft, clean it up just a little bit for nice electronic transmission, and submit it this afternoon. Being clear, we're not in phase 3, we're applying for phase 3.
Thank you. Any questions?
Yeah, Dave, appreciate all the work that went into this from you and staff and our outside partners at the hospital districts. What would look, for the average citizen resident of Mason County, what would look different between phase 2 and phase 3 as they go out and about?
Really, phase 3 is an extension of the release done in phase 2. So you'll have an increased capacity for restaurants, for example, go from 50% capacity to 75% capacity. Theaters, walk-in theaters may reopen at 50% capacity, and then the drive-in theater was already open, so it opened several weeks ago under a phase 2, so that doesn't change that much. We are withholding with the county the ability to not authorize pools and spas to go forward without, we're going to take a further look at that and bring that back to the commission, as well as county-owned ball fields. We're authorized to go to 50 people per ball field, but we have several of our facilities that have more than 1 field, so it's a question of do we have enough people at this time to manage those fields at 50 people per field. Because we have the complex that has 7 fields, we can have 350 folks there. And then what do we do about the common areas? So we're reserving that in our application to say we will address that in a second step on this process. We'll bring that back to County Commission once we've worked with our Parks and Recs folk and then Public Health as well to make sure that our pools and spas get their inspections done prior to reopening.
So will you handle pool and spa opening on a case-by-case basis?
Right, I
once it
think
comes
our
back up?
staff's already working on those, so I think some of them will be ready to go all right away, but we'll come back to the commission with an update on that.
Okay. Thank you.
Have a motion?
Yep, Madam Chair, I move for approval to move from Safe Start from 2 to Phase 2 to Safe Start Phase 3 as presented.
Second.
Okay, we have a motion and a second to approve Mason County application to move from Safe Start Phase 2, their Variance Phase 2, to Safe Start Phase 3. Oh, any comment?
Yeah. For those that, I get contacted a lot, but a lot of people, some people were upset and wanted to automatically move into Phase 3 on the third week. It just doesn't work that way. For many, I'd like them to know that, but I'd also like them to know why I didn't just fight and push that we have everything set up so that we can go on the day that we were finally allowed to turn it in. There's a lot that goes into this stuff, and when your staff and your doctor is recommending that we have an opening date at a certain time so they can put all their pieces together, roll it out in a way that will keep people safe, that is the smartest and best way to go. I'm not the mayor of Seattle or New York, the governor of New York. Our job is Mason County, and our job is to protect the people here and make sure it's safe. On a personal note, I follow the stats all the time, and one of the problems that I've been waiting for and watching is the 2 weeks, because immediately you had people that were saying, oh no, it was blowing up because as soon as they approved it, people started getting sick. Well, it takes a while for you to even know if that's even happening. And the way the state's statistics run, they actually have a window where it's pretty gray. And so you could have 14 days, but you don't actually have 14 days of information. You have to go another week to even get to that point. So I just wanted to make clear, it was a situation where I personally thought it was better to measure twice and cut once. I didn't want to play catch up on this, so that's why I didn't fight for or try to get us to open earlier. And I think our staff is correct to do it the way that we're doing it. So I want to thank you, and for those at home that are getting mad, my apologies, but again, I still think it was the right thing to do to wait until the proper time and what was recommended by the people that we pay a lot of money to know these things for.
Yeah. No, I do want to thank staff and you and the EOC, and there's a lot of players in this, and it's very appreciated. So thank you.
Thanks.
Thank you. All right, so now we have a motion and a second to move forward. All in favor?
Aye.
Aye.
And we're approved. Go forth and send.
Okay, thank you.
All right, moving on to item number 9. Other business. Do we have any department heads or elected officials that would like to say anything?
They're probably tired of talking to us.
I think so too. All right, we're gonna move on to item number 10. It's a public hearing set for to consider approval of the budget supplemental appropriations and amendments to the 2020 budget. Ask staff to come forward.
Good morning, Commissioners.
Good morning.
The requests for 2020 budget supplemental appropriations and amendments are as follows. Total adjustments to authorized expenditure appropriations in the general fund are $497,837, and that's detailed in the following departments. WSU, $1,500 for noxious weed professional service contract. Auditor, $169,510 for COVID-19 CARES Act U.S. Elections Assistance Commission grant. Community Development, $199,949 for Belfair Urban Growth Area Environmental Impact Statement contract. And in non-departmental, $126,878, and that's for an increase to the CDBG Public Services grant.
And total adjustments to authorized expenditure appropriations in funds other than the general fund are $2,618,530 in the following funds. The auditor's O&M, $3,125 for risk pool insurance that wasn't budgeted during 2020, so it's just a correction. Community support services, $485,405 for COVID-19 housing grant. Community support services, $50,000 for United Way of Mason County Professional Services contract for COVID-19 relief. Community Services Health Fund, $20,000 for the COVID-19 housing grant. Skokomish Flood Zone, $60,000 for Mason Conservation Professional Services. Belfair Sewer Fund, $2 million for Department of Commerce grant revenue for planning and design of sewer extension to PSIC. And that is it. Are there any questions? Okay. Thank you.
All right, thank you. Okay, during this time, have we had anything come in via email?
No public comment has been received.
Okay, great, thank you. Okay, do we have a motion? Or deliberation or a motion?
Madam Chair, I move for approval of the budget supplemental appropriations and amendments to the 2020 budget as presented by staff.
Second.
Okay, we have a motion and a second to approve budget supplemental appropriations and amendments to the 2020 budget with recommendations from staff. All in favor?
Aye.
Aye. All right, thank you.
Thank you.
All right, let's move on to item number 11, board reports and calendars. Commissioner Schutte, if you could go first.
Sure. Madam Chair, in addition to our regular EOC meetings in the mornings and all of our WASAC meetings, I also have a meeting of the Hood Canal Coordinating Council this week, meeting of the Thurston Mason BHA ASO. Also have a Hood Canal Coordinating Council Shellfish Initiative meeting, as well as a Law Enforcement Assisted Diversion policy group meeting to round out the week.
Commissioner Mesa.
Yes, we meet each morning for the area command meeting. COVID webinars, Olympic Regional Clean Air Authority, meeting of the Economic Development Council. Met with staff in regards to the vacation of the Roybud Road project, and they went out there and we walked it together. I met with representatives of Waste Management to go over some of the issues that they're having and we're having. I've been meeting with constituents again at the restaurant, so if anybody needs to meet with me, I'm back to doing that. I had a meeting of the ARC briefings, and we had a special meeting of the Board of Health this morning. After this, we have a webinar with Washington State Auditor regarding Corona funding. Local Social Service Task Force meeting, North Mason Chamber of Commerce Board meeting, where we're actually going to see each other face to face. We're going to have a meeting at the park and be distance away from each other, so that it's going to be interesting to be able to do that.
Oh, that'd be cool.
Been meeting with constituents and other different things. Peninsula Regional Transportation Organization meeting and LOSAC webinar that we'll probably all be attending and briefing, and we start over again. And happy Father's Day to all the fathers out there. I'm a mother of a father.
You confused me on that one, but
Yeah.
good job. So we do have our EOC meetings Monday through Fridays. Wednesday, goodness. Today at noon is the CARES Act funding with WASAC. Have a recovery ops meeting. And then also today they're having a parade for our 2020 Shelton seniors. So I'd encourage people to go out there and show your support. It starts at 2:30 and it will go from 4th Street to Railroad, down to 7th Street, up to Olympic Highway North, to Wallace Newland, and then to Shelton Springs Road, and then through the drop-off lane and student parking lot at the high school. So if you're interested, please go show our seniors your support. I have a DNR litigation call on Thursday, Turning Point Board meeting. And then we have a weekly Friday webinar with WASAC. And then we're back here on Monday, but I'd like to also extend a happy Father's Day to all the fathers out there, fathers to be, or even the fur fathers, I guess. That works. All right.
Just one real quick thing before we head out, just, we got an email last night from the governor's office that he is requesting an extension of the restrictions on the Open Public Meetings Act and Public Records Act, and so that was set to expire tomorrow, and so it's up to the legislature to concur with those changes. So for folks that were maybe planning to come back next week to our June 23rd meeting, just stay tuned for action from the governor and the legislature on extending or not extending that that order. So stay tuned.
Right, I believe we should hear word either on tomorrow afternoon or early Thursday. Thank you for bringing that up.
Madam Chair, I move we adjourn.
Second.
All right, we're adjourned.